Hey students, it's Dr. Ways, and welcome to your lecture on the eye. To talk about the eye, first we have to talk about where it's located, and where it's located is within the orbit. And we've already started talking about the orbit when we talked about the bones of the face. So just to give you a brief reminder, the orbit's made up of several bones. You have the frontal bone forming the superior border, the zygomatic bone forming the lateral and inferior border, the maxilla also forming part of the inferior border, extending to the posterior portion, and as well as the medial border. The lacrimal bone forming the medial border, ethmoid bone contributing to the medial border, the palatine bone contributing to the medial border, and the sphenoid bone contributing to the posterior border. So we've talked about the several nerves and blood vessels that come out of the various foramina that are within the posterior portion of the orbit. But you should also realize that aside from the eyeball being in there and all the nerves and blood vessels, there is connective tissue that's holding the eye in place, as well as fat pads that are around the eye socket, and some glandular tissue that form tears, exocrine glands that form tears. And if we strip away all that fat, what we'll find is the eyeball in there, and then all of the intrinsic muscles of the eye that are surrounding it that will allow the eye to move. So the parts of the external eye that you should be familiar with, on the outer border of the eye is called the outer canthus. Therefore, the inner part would be called the inner canthus. The spot here where tears are going to drain into is called the puncta, and that's going to be a spot where tears drain into. You can see the ducts, the lacrimal canaliculi coming here, joining into the lacrimal sac, and that's where tears are going to drain. And remember, the tears draining into the nasolacrimal duct are going to empty into the inferior meatus of the nasal cavity. Surrounding the eyelids, which are also known as palpebrae, are the eyelashes, which have a protective function. If something, let's say a fly is flying towards your eye and hits the eyelashes, immediately we blink so that the fly does not get into the eye. So the eyelid plus the eyelashes have a protection function, but we also see this lacrimal gland up here in the outer, the lateral superior border of the eye, and this is what produces tears. So you see all of these little ducts through which tears are going to go into the eye, and as we blink, we take that fluid and spread it across the eye, and then of course it gets drained into the lacrimal apparatus. The other function then, in conjunction with the lacrimal gland, is for the palpebrae or the eyelids to moisturize the eye. All right, the space between the eyelids, whether it's open or closed, is called the palpebral fissure. All right, one more thing to point out is that attached to the eyelid right here is going to be the tendon of the levator palpebrae superioris muscle, and this is a muscle that's responsible for opening, for contracting and opening the eyelid, which then opens our eyes so that we can see. Looking a little more closely at the internal structure of the external eye, here is our levator palpebrae superioris muscle, and here it is attached to the eyelid, so it contracts and it's going to open the eye. And then you have the superior tarsal muscle, which is smooth muscle, and that's going to be involved in reflex contractions of the eyelid, although its role is not fully understood. The next structure is the tarsus or tarsal plate here in the upper palpebrae. And what it is a thin sheet of connective tissue to which structures can attach, such as the levator palpebrae superioris muscle. And within it, it's going to have little glands. And what these glands do is, as described here, they're going to secrete a lipid-rich substance that's going to mix with the tears and increase the viscosity. And what that does for the tears is it makes them slightly oily, so it takes longer for the tears to evaporate from the eyelids, and therefore doesn't dry out the eye as fast. Being oily, it will also prevent the eyes and the eyelids from sticking to each other, so that there's a fluid movement whenever the eyes are moving or whenever the eyelids are moving across the eye. Attached to the surface of the eyeball is a structure that you're familiar with. It's called the conjunctiva, and it's a clear membrane that covers the entire surface of the eye. But what we see here is that the conjunctiva actually spreads up into this space between the eyelid and the eye as well. So it's not just on the surface of the eyeball, it's actually part of the eyelid as well. So a repeat of what we've talked about with the lacrimal apparatus. Here we have the lacrimal gland on the superior lateral portion of the eye. Tears are secreted through this. Through blinking, they get washed across the eye and drain into into the lacrimal puncta, into the lacrimal canals, and then drain into the lacrimal sac. And remember that lacrimal sac will then drain into the nasal cavity on the lateral wall at the level of the inferior meatus. And again, that's why when we're crying or when our eyes are teary, we'll also tend to get a runny or stuffy nose. The only other thing that's on this slide that was not mentioned is that within the puncta, you have this area called the Lacrimal Lake. And the Lacrimal Lake is where the tears are going to tend to, or lacrimal fluid is what they're called, tend to accumulate before they are drawn by capillary action into the lacrimal canaliculi. Alright, the eye movements are supplied by the extrinsic muscles of the eye. I think I said in a previous lecture that these were intrinsic muscles of the eye, but they are in reality extrinsic muscles of the eye because they occur on the eyeball. What I was comparing them to before were the muscles of the eyelid that we discussed in the previous couple slides. So these muscles are called the extrinsic muscles of the eye, and there are 6 of these muscles. We have the superior oblique, which we've talked about right here, that's going through the trochlea, which would be supplied by the trochlear nerve, which is cranial nerve 4. We also have the lateral rectus right here and right here, which is controlled by the cranial nerve 6, which is the abducens nerve. And then the rest of them are controlled by the ocular motor nerve, cranial nerve 3. So that will consist of the inferior oblique right here, the inferior rectus here, the medial rectus on the other side here, and the superior rectus up above, as well as the levator palpebrae superioris. Okay, so all of these, again, fixing a mistake I said earlier, extrinsic muscles of the eye. And as we talked about in the cranial nerves lecture, these are the directions in which these muscles move the eye, and this slide talks, or this picture image rather, talks about the position the eyes need to be in order to test the particular muscles in question. So that relates to our 6 cardinal fields of gaze. So go ahead back to the cranial nerves lecture and remind yourself what the 6 cardinal fields of gaze are, and which directions they are, and which muscles are being tested in those gazes. As for the structure of the eye itself, remember we talked about in a previous few slides that there is this conjunctiva that is right here, and that's going to cover the very surface of the eye. And just underneath that, we have different layers to the eye. Anteriorly, we have the cornea, which of course is going to be clear because light needs to pass through, but then that's connected to this layer of the eye, which is called the sclera. All right, and the sclera is that white part of the eye. Just deep to that, we have this pigmented and highly vascularized layer called the choroid. And the reason why it's pigmented is so that light does not bounce all throughout our eyeball and goes specifically to discrete locations and doesn't bleach out images. All right, so that's the reason that it's pigmented. And then the innermost layer is going to be the retina. And the retina is where we have those cells, the rods and the cones that detect light and process that image and send it to the optic nerve back here. All right, within the eyeball itself, where the optic nerve exits is a space called the optic disc, and there are going to be no rods, no cones, no vision receptors in this area, so that's going to set up a blind spot for the eye. All right, adjacent to the optic disc is going to be an area called the Phobia Centralis, and the Phobia Centralis is going to be a region that contains a lot of cone cells for the eye, so that color vision, and it's going to be contained within a region that's not labeled here called the macula lutea. And so this area in general is going to be where our sharpest vision is going to occur. The cavity inside the eyeball is called the Vitreous Chamber, and it's filled with a jelly-like fluid called the Vitreous Humor. And the purpose of this fluid is to, one, be clear so that light can pass through, and two, being jelly-like, it is going to apply pressure to the retina, because if you've ever dissected an eyeball and have taken it apart, once you take out the Vitreous Humor, the retina is pretty loosely attached to the eyeball. So this Vitreous Humor provides pressure to keep the retina tight against the choroid layer so that your vision remains intact. All right, moving anteriorly, we have the lens, and the lens is going to be this obviously a transparent material that's going to focus light coming from the front of the eye, coming from the cornea, onto different parts of the retina to produce vision. And the lens is attached to these structures right here called suspensory ligaments that are also then attached on the other side to the structure called the ciliary body. And the ciliary body has muscles in it, and these would be truly one of the intrinsic muscles of the eye that pull on these suspensory ligaments and will help to adjust the lens so that light coming through can be focused appropriately on the back of the retina. The other intrinsic muscle of the eye is this right here, which from a side view just looks like a couple of muscles, but it goes all the way around, and it's what gives color to our eye, and that is called the iris. And in the center of that iris is a hole through which light goes and interacts with the lens, and that structure, that hole, is called the pupil. And so the iris then, being muscular, that's what causes our pupil to dilate or constrict, to let more light in or less light in, depending on the vision conditions and the needs of what you're trying to look at. Between the iris and pupil and the cornea at the anterior end, we have what's called the anterior chamber. And within the anterior chamber, you have a watery fluid called the aqueous humor. When you get into physical exam and you are looking at the eye with your scope, this is what you're going to be viewing. All right, it's the back of the retina. And a couple of things to point out that you're going to see looking at this picture right here. Notice that this is the temporal side. That means the lateral side or the opposite side of the nose. And you can see from that the fovea and the macula, remember that's going to be your most concentrated, sharpest image generation, is located on the temporal side, and the optic disc then is going to be located on the nasal side. All right, so fovea and macula, lateral, optic disc, medial. All right, or temporal and nasal. Out of the optic disc, you can also see retinal arteries and retinal veins, and that is what this picture is showing you. And one of the things that you should be able to tell is the difference between arteries and veins. And if you look, the veins tend to be a little bit larger, whereas the arteries are a little bit smaller in diameter. And that shouldn't be any surprise to you, because you've seen that elsewhere in the body, where veins are these big, long, large, flappy structures, and the arteries are small, muscular structures. The number of arteries to veins that you should be able to see is about 2 to 3. So you should see about 2 arteries for every 3 veins. Approximate. You're not going to count them, but as long as you're seeing about that ratio, that's what would be considered normal. If you see less than that, that could indicate a compromise in blood supply. If you see more than that, that could indicate a compromise in the ability of the tissue to take up oxygen, so new arteries and veins are growing to help distribute that blood supply a little bit more, both of which are going to be problems. All right, one more thing you should be able to see within the optic disc. Notice that the optic disc, they have it circled here, is a relatively large structure, and then there is a central portion where the actual nerve is going to be located, and that is called the optic cup. And what you see is that the optic cup is slightly off center in relation to the optic disc, and it's about 40% of the size of the optic disc, and that's again going to be considered normal. All right, and in this last slide, we'll remind you that sclera right here is the outer layer of the eye, the white part. This is going to be the cornea. This is going to be your choroid. Remember, that is vascularized and pigmented, and it prevents light scattering so that you don't have bleached out vision. And then this structure right here, which extends from the choroid, the whole thing is called the ciliary body. And the ciliary body is composed up of ciliary muscles as well as ciliary processes, again, that are attached to these suspensory ligaments, and when they contract and relax, they're going to pull and stretch out the retina, I'm sorry, not the retina, the lens, or cause the lens to not be stretched out, and that's going to basically change the way light is focused on the back of your retina, and that process is called accommodation, all right, our ability of the lens to focus light. All right, the epithelial tissue that lines the ciliary body is going to be responsible for producing, remember, it's part of the choroid, so it's going to be highly vascular, so it's going to be responsible for producing the humor, the liquid that is within the eye. And so that's going to spill out into the what we call the posterior chamber, come around and fill up the anterior chamber. All right, so just to distinguish, the anterior chamber is between the cornea and the iris, and the posterior chamber is between the iris and the lens. All right, so that liquid's going to come out and fill up the anterior chamber, and as it's filling that up, that's going to be some circulation of fluid. And so with any type of circulating fluid, you all want it to be reabsorbed, because if you're producing some, you want a place for it to drain. And where it's going to drain is this scleral venous sinus. So that's going to drain the excess fluid in the anterior chamber and allow for a continuous flow so that fluid is constantly refreshed.